Hi, my name is Steve Hodgson. I'm a physiotherapist and director of Hallamshire Physiotherapy. Today I'm going to talk to you about muscle injuries. It's very common and why people with muscle injuries for whatever reason don't get better. Muscles get blamed for many things. They are actually pretty robust. If you pull a muscle, most people will never see a physiotherapist. Within 24-48 hours they feel a lot better. Usually within a week or two most people are back to function. So if you pull muscles, they do get better. We tend to see people who come in probably into two categories. The first category of people coming with muscle pain is when it's actually not actually coming from the muscle, it's referred from something else. So if people come with pain into hamstrings or into the shoulder and think it's a muscle, invariably when you look at it they've actually got a referral from the neck or the lumbar spine in the hamstring case, which is actually producing pain within the muscle but is actually a referred source. In that case you have to deal with the underlying problem. The other time people come in muscles tears or pulls is usually when they're using the muscle inappropriately. So if you come in with a repeated calf strain, for instance, people will be running on the tiptoes, they've always done that, and then they have some new activity such as increasing the distance or running up and down stairs, or they start to go to another club. This produces additional stress on the calf and they keep tearing it. So if when people come with calf tears, for instance, you have to look at how they run, how do they walk and how do they move. And they may have been doing this for many, many years, but eventually the muscle, which is often quite large at the time, says, I've had enough of this, and bang, you keep tearing it. You have to change how you walk and how you move. By changing the stresses through the muscle will improve. So it's looking at the cause of things, not just dealing with the local problem. If you rub it with ultrasound and massage it, it'll make no long-term improvement unless you deal with the underlying movement dysfunction. This is the same with the hamstring tears, which is another big common area of problems. Footballers present on a regular basis with repeat hamstring tears. When you look at the hamstrings themselves are fine. They may not even be shortened at all, but what they're doing, the hamstrings have been used to control the pelvis and the lumbar spine because of the way the person uses their body. If your lumbar spine is held into a lordotic position, which is when it's arched and it's locked into one position, you tend to find you can't control your lumbar spine. So to make the body move, you start to use your hamstrings as an additional way of stabilising and controlling your pelvis. You try to kick a ball, your hamstrings are thus trying to hit the ball as well as to stabilise your pelvis and control it. If you can't do this, you keep tearing the muscle. So people wonder why they've had repeated trauma through the hamstring. You address how they do it. And this is often the cause of many of the injuries that we see. Muscles are incredibly robust. If you treat them correctly, they get better. If you increase your performance no more than 10% a week, muscles will cope with most things. So to recap, if you do get problems with muscles, A, start to think, do you really have a muscle problem, or is it just a referral into that area, which is often very common? And if you are getting a muscle problem that's not getting better, consider why that muscle is tearing, why you're having problems with it. There's usually some reason. Once you can address the reason, you're more likely to have a long-term improvement. Thank you very much.